Bad weather?
This is the last time we ever do this. When we get back, we're going to Ocala Aviation and getting our pilot's license.
Yeah, we've been talking about that long enough. It's about time we did it. Then we could just fly ourselves and never have to deal with this mess again.
Right. No long lines, no full body groping security, no baggage checks.
Not to mention never losing your luggage. Remind me again why we haven't done that?
Well, we're idiots.
Oh, right.
Attention all passengers for Flight 1370. It looks like the plane is going to be delayed a little bit longer. The airline has lost the pilot's luggage. Isn't it time you got your pilot's license? Call Ocala Aviation today. 352-861-7484. That's 352-861-7484. Hey, you've earned it. Call today. Broadcasting from the Paddock Mall Studios, this is WOCA, Ocala, Gainesville, The Villages, 1370 AM, 96.3 FM, The Source.
All right, 21 minutes after 8 o'clock. Thank you for tuning in this morning. I have to reveal that I'm old in order for you to understand why I'm saying what I'm saying.
Okay.
Because when I was a kid, now this is in the 60s, okay? Now I just told you I'm not young at all. But I remember one of the kids in my school had an epileptic seizure. Probably the first time I heard that word, epileptic seizure, right?
Uh-huh.
And I remember the teachers, it was like everybody was scared. Don't let him swallow his tongue. I remember that. Don't let him swallow his tongue. And I was thinking, you can do that? Mm-hmm. You can swallow your tongue?
Yeah.
I didn't even know that was possible, right? There has been a lot of progress made in medicine and in epilepsy specifically. Dr. Danielle Becker is on the phone. She is an epilepsy specialist with Penn Medicine at the University of Pennsylvania. November is Epilepsy Awareness Month, and they took a survey. WebMD took a survey. I think it was them. The STEP survey sees the truth about epilepsy perceptions. Let's find out what we now know that we didn't know. Good morning, Dr. Becker. It's an honor to have you on the show.
Good morning. Thank you for having me.
Where are you? Where are you calling from?
From Philadelphia.
Philadelphia. All right. Well, thank you for being on the air with us. It seems like we probably have made a lot of strides since, when I was a kid. It was a long time ago.
We are still making strides. So a lot of people don't realize how prevalent epilepsy is. More than 3 million people in the United States have epilepsy. There's 150,000 reported new cases every year. But to boil it down, just as you said, with one of your classmates, 1 in 26 people will have or develop seizures at some point in their lifetime. And you are correct. There was a survey that was actually done to get a better understanding of the state of epilepsy and try to improve doctor-patient relationships. And what the survey showed is that there's a lot of disconnects. So 3 out of 4 patients and caregivers will say that they struggle to feel normal, that they live in fear of when their next seizure is, and they feel very isolated.
Yeah, I bet. So does the survey give the doctors a way to better serve? One question I guess I have about it in general is it's not cookie cutter, right? One person's epilepsy is not the same as somebody else's.
You're correct. Everybody is different. Individual seizures, how they react to medications, how it affects their life. So what was developed from the results of this survey was a tool that patients or anyone in the epilepsy community can download at webmd.com/epilepsy survey. And what it is it's a piece of paper that patients can fill out before they go to the doctor's visit, which can help them get the most out of their visit and also get them thinking about their life goals and what they want to talk to their physician about.
And are there any signs that a person may have an epileptic seizure, or does it just all of a sudden come on to them?
So unfortunately, it's usually sudden, unprovoked seizures. Now, the seizures can be many different types, but it usually comes out of the blue, and patients are not prepared for it, which is part of the reason why they continue to live in fear for when the next seizure might come.
So when they are diagnosed with epilepsy and they're given medications, is sometimes the medication ineffective?
So 2/3 of patients with epilepsy are controlled by their medications, but that leaves a third where the medications are ineffective, and then you have to look at alternative treatment for their epilepsy.
Okay, and is the survey accessible to the general public, and how would it help me? How would that survey help me?
So it can be found, results of the survey can be found, again, as I said, at webmd.com/epilepsy survey. It helps the general public just with awareness. It shows that these patients are affected emotionally, socially, in the workplace. 50% of patients will say that they're limited by what job they can take. They may even lose their jobs. So you might even be working with someone who has epilepsy and have no idea what they're going through. So overall, it's meant to improve awareness.
And that's one thing I think I would be scared of. If I saw somebody having an epileptic seizure and I knew whatever rules I'm supposed to know about handling them, I wouldn't know really how to identify whether it was epilepsy or something else.
Well, the good news is if someone has an epileptic seizure in front of you, most of them are self-limiting and resolve within 1.5 to 3 minutes. The biggest thing is you just want them to be on their side and maybe put something underneath their head. But it will self-resolve. And believe it or not, it's more scary probably for the individual than it is for you.
Are people that apply for driver's licenses, is that one of the questions on the driver's license exam? And are people that have seizures given a driver's license?
So if you have active seizures, you cannot drive. So there's actually 6 mandatory reporting states in the country, and I live by 3 of them, where if a patient has a seizure, you have to report it to the DMV, and they cannot drive unless they're free from seizures for 3 to 6 months, depending on the state they're in.
And because of these limitations, do these seizures sometimes go unreported?
They probably do go unreported. The thing is that this is why education is so important. So one, to educate the patients to understand what can happen if they do have a seizure while driving. But believe it or not, the patients are scared of that. They don't want to get hurt and they don't want to hurt someone else.
So Robin's question about driving, I noticed on your website there's the Uber and a few other organizations are actually helping out, right? Or maybe we can help out in some way. How can we help out?
Yeah, so SK Life Science partnered with the Epilepsy Foundation to do this new never-done-before ride-sharing program, where during the month of November, there are $20 vouchers that are given to patients so that they can use that to get to their office visit, to get to work, something really to just show that we need to improve awareness, especially during November, which is the National Month of Epilepsy Awareness.
And is this age specific, or can anyone have a seizure from a newborn to the generian?
Anyone can have a seizure from a newborn throughout their lifetime.
And is it hereditary?
Some epilepsies are hereditary. In fact, they're still investigating a lot of different genetic components that cause seizures. There's many different reasons you can develop epilepsy, and sometimes we don't even know why in some of our patients.
The website that I was given is webmd.com/epilepsy survey. Is that correct?
That is correct.
And that also takes you to webmd.com/truth about epilepsy. I'm guessing it's one and the same, right?
Yeah, well, the survey is actually called STEP, and it stands for Seize the Truth About Epilepsy Perceptions.
Okay.
And is there emotional support groups for the caregivers?
So there are support groups. A lot of them are through the Epilepsy Foundation, so you can go to your local Epilepsy Foundation. They're for patients, for the caregivers, for the patients and caregivers to go together.
All right. Dr. Danielle Becker, thank you for the work you do. For those of you who turned up the volume because you know somebody with epilepsy, or maybe you do, the website again is webmd.com/epilepsy survey. Plus, Robin will put this up as a podcast before 2 o'clock today. Dr. Becker, thank you for being on the show with us today.
Thank you so much.
You're welcome. We'll be right back.
Broadcasting from the Paddock Mall Studios, this is WOCA, Ocala, Gainesville, The Villages, 1370 AM, 96.3 FM, The Source.